You're watching PCTV Channel 17, proudly serving the Port Clinton City School District community. The following is a production of the Port Clinton High School Digital Media class.
Welcome to Time for Health. I'm your host, Rachel Fall, and we're very glad you've joined us. We hope you gain something from the program that helps you and your loved ones. We want to arm everyone with as much information as possible so we can all make good choices. This is not to take the place of regular medical care, so be sure to include your healthcare provider in on your plans and your conversations. And today, our guest is Jane Klett. Thank you for being here.
Thanks for having me.
We are talking about oral health, dental health, all that good stuff. You're from the Dental Center of Northwest Ohio, so I guess tell me a little bit about you and your professional background and a little bit about the Dental Center too.
Absolutely. I am a dental hygienist, and I've been with the Dental Center for 10 years, and I work primarily in the community. I'm the Director of Community Development and Outreach, and I implement grants and oversee grants that get us into the community and get oral health into places that otherwise maybe wouldn't have oral health. The Dental Center is one of the gems, I think, of Northwest Ohio. It has been in Toledo 105 years. A nonprofit that was started by a group of dentists, and we provide dental care to people with limited access or limited resources for dental care. But we also, a part of our mission is to go out into the community to educate, to raise the awareness and the understanding of the value of oral health, and to advocate for people who otherwise wouldn't have care.
Okay, and you and I met not too long ago. You have a grant kind of trying to reach out to people and get the word out. So talk a little bit about that.
Absolutely. The grant actually is through the United Way of Greater Toledo, of which Ottawa County is considered Greater Toledo. Yeah. So that's what brought me to Magruder and to speak with you. The grant is called Access and Refer, and the goal of the grant is to partner with other healthcare providers, doctors, nurses, nurse practitioners, but also social service agencies, so outreach workers and social workers, to really be focused on doing an assessment, an oral health assessment, and referring for care.
Okay, all right. So when we met and talked about all the outreach and the education and the grant, you shared so much information with me, and when I think of oral health, I think of cavities, because I might have a couple.
Many of us do.
Fillings, things of that nature. But oral health is so broad and has such an impact on so many other parts of a person's health. Talk a little bit about that. How is it so connected? How can what happens in here affect so much other stuff?
I really appreciate being here because that's really the gist of what I try to do at the Dental Center. And I think it's really important for everyone to understand that there are different types of infections in the mouth. And first of all, the mouth and the nerves and the blood vessels and everything is connected to the rest of the body. It doesn't happen outside of the body. So when there is a chronic infection and the same bloodstream is feeding that part of the mouth, the good blood comes in, the new blood, and then the other blood goes away, then it's just taking those toxins and everything with it to other parts of the body. There are two main diseases that we tend to think about, and you mentioned one, the cavities, and that is a bacterial infection of the hard structure, the teeth in the mouth. But all the teeth are surrounded by gum tissue. Yes. And the teeth are held into the bone by a ligament. So when we talk about gum and bone disease or periodontal disease, there's actually 4 structures that we're talking about. We're talking about the bone, the ligament, the gum, but also the root surface, the cementum on the root surface. So it really is much more complicated than what most people would think. And gum disease, for the most part, is not painful. which is different from cavities. Usually a little start of a cavity, and boy, you know it right away when you're eating or drinking. Cavities, interestingly enough, if they get large enough, and if the infection reaches the middle of the tooth where the nerve and the blood vessels are, it can kill the tooth, make it devital, and then the tooth really doesn't hurt anymore. So sometimes people, if you look at their mouths and you see that they have black teeth, or there's just a shell of a tooth left, and the person won't complain of pain, which is why if a nurse or a doctor asks, do you have any problems with your teeth? The person might say no. You know, a couple years ago it hurt kind of bad, but it doesn't hurt now.
Gotcha, that's
so the pain is gone because the nerve ending is dead, but the bacterial infection is still there.
Okay.
Right.
And how, you talk about infection, like how does an infection start in the mouth? Is it just, not brushing and flossing and the bacteria just gets stuck in there?
Yeah, well, kind of.
Okay.
Yeah, and it depends on what disease process we're looking at. Cavities and gum disease are two different disease processes, and they're really caused by different bacteria. So it depends on the bacteria that is primarily living in your mouth. For cavities, certainly missing an area brushing, not getting to the spot, so in between the teeth, not flossing or not cleaning in between the teeth, or not cleaning around the gums. So certainly that's how that might start. It might also start in the biting surface and what we call the pits and fissures of the tooth. So the acids that the bacteria makes just can penetrate down into the surface of the tooth and start a cavity that way. As far as gum disease, normally it's kind of the same because you're not, if a person's not brushing their gums, not using a good technique to make sure that the gums are clean as well. The difference, however, is that the gums will swell in reaction and actually start pulling away from the tooth. It'll actually detach itself from the tooth, making a little pocket where more bacteria falls in deep, and so then it just becomes cyclical at that point.
Okay. And I heard long ago, I have a family history of heart disease, and they said that flossing had some impact on heart disease, and I thought, oh, good.
Absolutely. Well, I think any dental professional will agree that sometimes people aren't as forthright with their flossing habits as if they're talking with their dentist. They'll say, oh, I floss every day, or I floss most days. And that may or may not be exactly true. The point of someone saying flossing is really important is really just to clean in between the teeth and clean underneath the gums. What we've learned about what really is considered a low-grade chronic inflammation in the gums is that it raises the risk for heart attack and stroke. It also, and it's just that long-term infection as well as the byproducts of the infection that end up going through the body that is what is causing that. So it isn't gum disease maybe specifically, but it's just the result of having this long-term chronic infection that is painless, and most people don't know that they have it.
I was going to say gum disease, when you start to get a cavity, like you said, it hurts. Gum disease
generally does not hurt. There are some situations that can cause some discomfort or some pain, but for the vast majority, it really is a silent disease. In fact, many people get to the point where the bone is almost totally missing and not holding in the tooth anymore, and the teeth are really, really wiggly, and it still doesn't hurt. It bothers them that the tooth wiggles when they eat, but it really doesn't hurt. And so that can be a real problem as well.
So, when somebody has a cavity, they get a filling. Take the bad part of this is my, just enough to be dangerous.
Right.
Take the bad part of the tooth and put a filling in. What do you do for gum disease?
Primarily, it's the dental hygienist that works with that, at least in the early stages and in the maintenance stages. Having a thorough cleaning 2 or 3 or 4 times a year, depending on what your what the condition of your gums would call for. So the hygienist working with specialized instruments underneath the gums.
Okay.
I know that kind of
That
makes everybody go like that.
awesome.
With or without anesthesia,
Okay.
hygienists now are allowed by law and are trained to provide anesthesia shots in the mouth to numb
Okay.
up an area, and it's called scaling and root planing. So we're really
Sounds
clean. I
delightful.
know, doesn't it? Gum therapy is probably a nicer sounding term. Yeah,
Yes.
gum therapy.
Very nice.
But it cleans the root surface of the tooth, and it debrides the wound, as it were, around the
Okay,
tooth, so that it's more able to heal
Okay.
and to heal around the tooth. In cases that it could be just certain areas of the mouth, or sometimes it's many areas of the mouth, a specialist, a dental specialist, a dentist who has gone on to school to treat gum disease is necessary, and that's a periodontist.
Oh, I've heard of
A
it.
periodontist,
Okay.
yeah. So their focus is saving teeth and keeping the person as healthy as possible.
Okay. So, back to if you're not taking care of your teeth and this infection starts to affect all different kinds of areas, and the couple of situations you told me about, we just have another minute or two before we take a break, but I was just surprised that you had mentioned that there were people that needed, maybe cancer treatment or heart surgery, that because they had such an infection in their mouth that they didn't particularly notice, or it wasn't high enough on the radar for them, that they couldn't get their treatment because they had this ongoing infection. You can't have an infection when you get those kinds of treatments.
Right. That's especially true for head and neck cancers, cancers inside your mouth, on your tongue, cheek, that just the head and neck area cancer. And then, as you said, heart disease. I do some care management out of the Toledo office, but I've had some Ottawa County patients actually who were receiving care out of the Cleveland Clinic.
Okay.
And were referred to us to have dental care done, and that makes it just very, very difficult when you're working on life-saving treatment and the timing of life-saving treatment. And then you have some interesting diagnosis, and unfortunately it usually means the extraction of many teeth. And so that's just so hard for a person to be dealing with a life-threatening diagnosis, and then to find out they've got to do all this mouth stuff too, that they've been putting off their whole life because either they're afraid, or they don't know, or they don't have the money, or something like that. So it just adds a little bit of angst to the whole.
That just surprised me that, yes, oral health is important, but gosh, how it can impact something incredibly serious. All right. We're going to take a break, and we'll be right back. About the importance of oral health, and you learn from a young age, you need to brush and floss your teeth and take care of your teeth, but how that can seriously impact some really big areas of your life. Also, when we met, you talked about some people just aren't dentist people. If your parents, very rarely went to the dentist, or your grandparents, or whatever, that some of us, our parents always went, so we went, some don't. That just seems very foreign, but that's
absolutely very true. And I think that is very difficult for most dental professionals to wrap their minds around, because in the dental world, of course, we're brushing our teeth several times a day. We're flossing, at lunchtime before we go back in to see our afternoon patients. We're, our world is
Right.
is teeth, and so to realize that there are people out there who grew up in homes without toothbrushes, who maybe went to a kindergarten dental appointment
Right.
for school, but then never went again ever. It's just kind of hard to wrap your mind around. And I've been working in public health long enough that I learn. Every day it's like being a teacher. The students teach you every day what you really need to know.
Yeah.
And sometimes, my patients teach me what I really need to know. And some of the theories are kind of, there's a lot of myths, but also there's some theories. I had one gentleman tell me that their teeth only hurt really bad 3 times, and then they'll never hurt again. So they're talking about, they just know that the teeth are going to be infected and you might be swollen or whatever, but you just live through it 3 times and then they don't hurt. And of course, again, remember I talked about how even though they stop hurting, the bacterial infection can still be there.
Still there.
So it really is important. Part of our mission as the dental center to make sure that people understand that taking care of their teeth and their gums especially is a part of all of that daily self-care. You wash your hands, you wash your face, it's a part of a hygiene regimen that you do every day.
Right. There were some other things that you talked about when we met that I just thought I had never learned, so I thought maybe some other people never had heard either, but that about preemie babies, that they are typically more susceptible to dental problems, and that's not necessarily just accept it, but it's you might need to go earlier or more often or whatever.
Right. Babies' teeth start developing in utero, in the mommy's belly.
Right.
And during the time of delivery, whenever that happens, there is a disruption of the enamel being laid down, the tiny little enamel in the jaw. And so there's a disruption of that during that time of delivery. So preemies tend to have more dental problems, meaning cavities, than non-preemies. That doesn't mean that people just accept the fact that my kid has cavities. That means that the parents need to make sure that the child is being seen early and kind of often. The recommendation for seeing the dentist the first time is actually 15 years old now, and
15 years?
No, the policy.
Right.
Oh yeah, I'm sorry, I don't mean to confuse anyone. It's really to have your first check by the time of your first birthday, or right around your first birthday. Many of the pediatric dentists are saying by 18 months. So at least 6 months after the first teeth come into the mouth. So somewhere between the first and second birthday. But the ADA, the Association of Pediatricians, they all say first birthday. And that first came out in 2000, so that's what I meant, that we've been at this for almost a whole generation, and still a lot of people don't realize that. And again, the main goal is to identify any congenital problems, make sure the parents are aware, and it's just like a well baby check, but it's a well baby dental check. Absolutely.
And I would think maybe a thought might be that when children are small and they have their baby teeth, they're going to fall out anyway. So, but are there long-term effects for not taking care of your baby teeth when your big teeth come in?
Absolutely. The long-term effect is that children whose baby teeth have a lot of cavities are at the highest risk to have their adult teeth have lots of cavities. And primarily that's because of the flora, the bacteria that's living in your mouth, and the habits. Children learn habits, and tooth decay is really a disease of habits, of what you do or what you don't do. So if you're drinking, you see a lot of moms, or we see a lot of adults that put soda pop or Kool-Aid in baby bottles or even sip cups. So the little ones are just sipping all day long at something sugary. And those kids are going to have lots of cavities. And we see, unfortunately, lots of 2 and 3 year olds that have 6 to 8 cavities. And they only have 20 teeth in their mouth, you know. And if you think it's hard to brush a 2-year-old's teeth, you should
try to put a filling in.
Try to put a filling in. Yeah, it's a little hard on our end too, you know. So prevention goes a long way. Brushing teeth as soon as they come in, or for babies, even wrapping a wash rag around a finger and just cleaning the teeth when they're just now coming in, just the gums, absolutely, so that the children learn from early on. This is what we do. This is, you know, we take care of our teeth. So certainly the habits are a big thing.
One of the other thing you mentioned was medications in suspension, and children with asthma. Talk about those. Those were
oh yeah. So there's kind of like a children's version and an adult version of how medicines affect the teeth. And the children's version, you know, children often when they need an antibiotic, it's in that funky little pink stuff, right? You betcha. Every parent knows about, you know, the pink medicine. And the suspension in that, the part that makes the medicine taste good enough for the child to swallow to actually get the medicine in, is high fructose corn syrup, which is the same sweetener used in soda pop. So if you're giving them medicine 3-4 times a day, and of course at nighttime right before they go to bed, then you're just putting all that sugar on their teeth. So a lot of times children that tend to be medically involved, have lots of diagnosis and need medicine, it's all in this syrupy form. And you know, the parents you know, are in a difficult situation. They're trying to take care of a sick child. And brushing their teeth every time after they give medicine is probably not high on their list of getting through the day. It's a kind of a survival thing. So a lot of times children with medical problems tend to have more cavities, but not because of the medical problem, but because of the medicine. And then with asthma, the albuterol that's in the inhaler that you puff in is very acidic. So it just sits on, you know, on the teeth. And then for adults, there are probably 600 or more different medicines for things as simple as allergies and sinus issues, clear to heart medicines and chemotherapy medicines, the pills that they're taking that dry up the salivary glands. And so our teeth are meant to be wet. The saliva neutralizes the acids in our mouth, and it keeps our mouth healthy. When you're taking medicine, or if you're on camera and your mouth gets real dry, that means that the acids are able to flourish, the bacteria is able to flourish, the acids are not being neutralized, and it makes your teeth, the enamel, more at risk for decay. So that's kind of the adult version of that the medicines will dry out.
Don't take your medicine.
Oh, absolutely not.
But drink water.
Brush
a little more often.
And making sure that you have fluoride toothpaste. Those of you who are drinking city water, most of the towns have fluoride in their water, and so the water is a wonderful, inexpensive way to help that situation as well. I do want to throw this in that people who are abusing substances, pills, opiates, that kind of thing, their teeth really get bad. There is a condition we call meth mouth, because meth is very acidic and very, very bad, but sometimes people who are kind of keeping their habit under the table, not openly living in that environment, but you know, kind of have a closet problem, their teeth are sometimes maybe the first things that we really notice. Because if they are addicted to a substance, they're not doing a lot of self-care. And the medicines are really dry. They dry out the mouth.
Gotcha.
And then some of the drugs are just very acidic.
Gotcha.
And so it just compounds the problem. Unfortunately, fortunately, we're able to help people who have been successful in rehab, but unfortunately, many times by the time they come to us, we're doing full mouth extractions on 22-year-olds and making dentures.
Wow.
So for any of the kids that might be listening, when people talk about, hey, try this, or it's a good time, or you really just have to think that
Wow.
one time, and opiates and heroin is such a huge issue, especially in rural areas in Ohio, all areas in Ohio, that I think I would be remiss if I didn't mention it.
Sure, yeah. And the other thing you talked about was how oral health can affect like how food tastes. You had somebody that was like, I can't believe food tastes this good when they got some of their infection taken care of. Skin color, I mean, just overall health.
Yeah. When people have just really rampant decay and lots of infections, either in the teeth or the gums or both, the body is really just trying to fight that infection 24/7. And a lot of times people will get what they call pimples or gum boils on their mouth, and it's really painful because that's where the tooth or the gum is draining the infection. And this is really gross, but because but that's kind of
that's what happens.
That's what happens. But pus builds up.
Yeah.
The pus builds up, and a lot of the adults will just pop it. Pop the gum, and then the pressure, the pain and the pressure goes away. But that actually happens if you have large cavities that are open. The pus actually drains out, or the infection can kind of just drain constantly. And our taste buds are in our tongue, and when that kind of coats our tongue, it just changes everything in the mouth. And I did have a gentleman who had most of his teeth extracted, ended up with a full upper denture and a lower partial, and about 3 days, I believe, after the extractions, he called and he was so excited, and he was like, Jane, why does mashed potatoes taste so good? They haven't tasted this good since I was 16. And it was he was like, wow, do you know what mashed potatoes taste like? And again, this is one of those situations that I didn't really realize how chronic infections in your mouth can really change the way food tastes because of the chronic draining into the mouth. And again, we had this other young man who had never been to the dentist. He was 13, never been to the dentist, had just lots of decay and issues, and he was really sick. His face was gray and yellow, and he kind of walked. I mean, he was just like an old man. His body was so fighting the infection, and by the time we were able to get everything finished, his face had a nice color, and he stood up, and his eyes were bright and shiny, and he just felt better. Right. And it was that was probably the worst situation or the worst scenario I have ever seen in my over 30-year career as a hygienist. But the take-home message was, oh my goodness, we really need to get that message out. And it was actually that case that really started me plugging for, I'm not sure that our medical counterparts really understand, or they see it, but if the patient isn't in pain and if the patient doesn't think it's an issue, because most doctors will say, do you have any dental problems? And people with totally gnarly teeth will say, no, I'm fine. I'm good.
But what's happening on the inside?
Right. So it's the disease factor that's going on that they don't really notice is the problem.
Awesome. Thank you.
You're welcome. Thanks so much.
We're going to take another break, and we'll be right back. And we're back. I want to thank Jane for being our guest today, talking about oral health and the huge impact that it can have on your overall health, not just a couple of cavities or anything like that, but well beyond that. So also wanted to mention that the Dental Center of Northwest Ohio has the Smile Express that travels around, comes to the Sutton Center in Ottawa County. The number for that is 866-378-6965. So lots of good information today for ourselves, for people that we know, young and old, it all pertains. So make sure you share that information. And if you ever have feedback about a program or a suggestion for a future episode, please let us know by sending a note to Time for Health, 615 Fulton Street, Port Clinton, Ohio, 43452, or you can email Mrs. Pelz at the high school, cpelz@pccsd-k12.net. So again, think about all the things we learned about today, whether you want to use it for yourself or it might be important for somebody else, be sure to share it. And until we meet again, I encourage you to make time for health.